I think with COVID, right, if one thing was proven is that, telemedicine is an effective way of taking care of patients in certain contexts, and it's here to stay. It's definitely not going anywhere. It has become embedded as part of our teaching. We now even teach our residents how to do telemedicine, visits in their residency. So telerotations, guys, every program director will understand that due to COVID, that things change all the time, and so the ability to get an in-person rotation is somewhat difficult, especially for international graduates. So the fact that somebody from, like, let's say Bangladesh or whatever, who couldn't, for example, afford to come to the United States or afford to, get a flight and stay here and pay for a rotation, went out of their way to do a telerotation. I mean, for me, that's meaningful, because they could have just simply used it as an excuse and say, okay, I couldn't afford it, so I'm not going to do it, right? But no, they did at least a telerotation. To me, that still holds a lot of value. And especially what did you do during that time? Did you just sit there and watch someone, or did you have an academic discussion about patient care, right? Like we offer a tele version of a rotation, and in that you have high-level discussions about patient care, detailed discussion, right? I think that's very valuable. And if you can do it in person, I think it's better. But if you want to do mostly tele and sprinkle in a couple of in person, that's okay too.